Professor, it seems like we're always being told that our health system is broken. We're hearing daily about GP shortages, ambulance ramping, crowded wards. Just today, we've been reporting that aged care homes are closing, saying they can't keep up with the requirements. The Albanese government's bringing in about having nurses on site 24/7. What state do you think you're leaving our health system in now? How would you characterise the Australian health system as you depart?
Well, of course, there are challenges, and I think the government has recognised primary care, general practice is a challenge, and there's a big reform process in way to make sure we get more doctors into general practice, provide more multidisciplinary care, and aged care. There's a long reform journey, but internationally, our health system, in a number of measures, still compares very favourably to other countries. You know, our health outcomes remain good. If you are really sick, we have free and accessible care in our public hospitals. Of course, there are things that need to be improved, and primary care is clearly the biggest focus of both my department and the government at the moment, as is aged care. So I don't think we want to talk down the health system too much by compare our health system to many similar like-minded first world countries. We have good access and good outcomes, and they're the most important things. But of course, we can do it better, and we can improve equity of access, and there are things to do to recover from the COVID impact. You know, a lot of elective surgery was cancelled during COVID. We've got to try and restore the backlog of elective surgery, and we do have to do that continued work in primary care. So I think it's internationally, by comparison, it's not in a bad state, but of course there are things we can do to make it a lot better, particularly in primary care.
Professor Brendan Murphy, look, best of luck in your retirement. I know you've still got a couple of months in the job, but look, we just wanted to get you on and say thank you for your stewardship through that time. I think you were a comforting voice for a lot of Australians as we all went through that, and it's great that you're able to take some time to speak with us. Thanks so much.
Thanks, Ash.